The pill is small, white, unremarkable. You've been taking it every single morning for years without a second thought, trusting that it's keeping you safe. Your doctor prescribed it. The pharmacy fills it every month. And on paper, your blood pressure numbers look reasonable. So everything must be fine. But here's what nobody told you. For adults over 65, one of the most commonly prescribed blood pressure medications can quietly cause falls, confusion, dangerous drops in pressure, kidney damage, and in some cases, serious heart events. Not because the medication isn't working, but because it's working too aggressively in a body that no longer responds the way it did at 45. And the worst part? The symptoms it causes, the dizziness, the fatigue, the brain fog, are so often blamed on aging that millions of seniors never connect the dots. They just accept a smaller, slower, more limited version of their life. And they never know it didn't have to be that way. Stay with me, because what I'm about to show you could change everything about how you manage your blood pressure. I'm Dr. Hayes Anderson, and after 22 years in senior health, I've seen firsthand what happens when blood pressure treatment is calibrated for a 50-year-old body, but prescribed to a 70-year-old one. The consequences are real, and they are entirely preventable. In this video, I'm going to show you which class of blood pressure medication is most commonly overprescribed in seniors, exactly what it does inside an aging body, and the 4 warning signs that it may already be harming you right now. I'm also going to walk you through what a safer, smarter conversation with your doctor looks like. Because I'm not here to scare you away from your medication. I'm here to make sure you and your doctor are working from the same information. And I need to say this clearly before we go any further. Do not stop or adjust any medication before speaking with your doctor. But do keep watching, because informed patients who understand what's happening in their own bodies, have measurably better outcomes. That is not an opinion, that is a fact. Here's something that rarely gets explained clearly enough in a 15-minute doctor's appointment. Blood pressure guidelines in the United States were built on research that primarily studied younger adults. For decades, the thinking was simple: lower is better. Get the number down, protect the heart. The medications used to do that, particularly a class called calcium channel blockers, beta blockers, and aggressive diuretics, were designed with a younger cardiovascular system in mind. But after 65, the physiology changes. Arteries stiffen. The kidneys process medications more slowly. The nervous system that controls blood pressure when you stand up becomes less responsive, and the margin between therapeutic and too much gets much narrower. This doesn't mean blood pressure medication is dangerous for seniors. It means that the type, dose, and target number need to be reevaluated with age in mind. Most doctors know this, but the appointment is 12 minutes long. The prescription has been working for 3 years, and you feel mostly fine, or at least you've told yourself you do. That gap between what your body is actually experiencing and what gets reported at an annual checkup is where the problem lives. Let me tell you about Dorothy. She was 74 years old, sharp as a tack, former bookkeeper, the kind of woman who balanced her personal accounts to the penny and had never missed a medication dose in her life. She had been on a calcium channel blocker for blood pressure for 6 years. Her numbers were well controlled, consistently around 118/72. Her cardiologist was pleased every single time she came in. But Dorothy had been quietly struggling for 2 years. She woke up tired no matter how much sleep she got. She moved through her mornings slowly, holding on to the counter, waiting for the room to settle before she trusted her legs. She had stopped driving at night. She had started avoiding stairs. When her granddaughter visited and commented that Grandma seemed a little unsteady, Dorothy laughed it off. She was 74. This was just age. It wasn't age. It was her blood pressure running too low, particularly when she stood up, because her medication dose had never been adjusted as her body changed over time. When I reviewed her home readings and ran a simple orthostatic test, her blood pressure dropped more than 30 points the moment she stood. That kind of drop is called orthostatic hypotension, and in seniors, it is one of the leading causes of falls. We reduced Dorothy's dose. Within 3 weeks, her morning dizziness was gone. Within 6 weeks, she was driving again. Dorothy's story is not unusual. It is common. And it begins with a medication that was working exactly as designed, just in a body that no longer needed it at that intensity. So let's talk about the specific medication class I want you to understand. And then I want to walk you through 4 signs that you need to have this conversation with your doctor now. The class of medication most commonly involved in overtreatment of blood pressure in seniors is the calcium channel blocker. Drugs like amlodipine, nifedipine, and diltiazem, often combined with diuretics such as hydrochlorothiazide or chlorthalidone. These medications are genuinely effective at lowering blood pressure. That is not in question. The question is whether the dose and the target are still appropriate for your age and your current health status. Here's why this matters more after 65. As we age, the baroreceptors, the sensors in your blood vessels that tell your nervous system to adjust pressure when you change position, become less sensitive. When a younger person stands up quickly, their body compensates in under a second. Blood pressure stays stable. When many seniors stand up, that adjustment is slower. If blood pressure is already being held low by medication, the gap between sitting and standing widens. The brain gets less blood for a fraction of a second, and you feel it as dizziness, as lightheadedness, or as that reaching for the wall sensation you've probably been ignoring for months. Stay with me, because what comes next is the part most seniors and most doctors never connect. Sign number 1 is exactly what I just described: dizziness or unsteadiness when you stand. If you grab for a surface when getting up from a chair or out of bed, that is not normal aging. That is a blood pressure event happening in your body. Write that down. Sign number 2 is unusual fatigue that doesn't improve with rest. When blood pressure runs too low, the heart and brain don't receive optimal circulation. Energy drops. Thinking slows. Many seniors on aggressive blood pressure treatment describe a persistent heaviness, not quite illness, not quite wellness, that they've simply accepted as their new normal. If this sounds familiar, it is worth investigating. Let me tell you about Robert. Robert was 78 years old, a retired engineer, meticulous about his health. He had been on 2 blood pressure medications for 4 years. His pressure readings were excellent, 115/68 consistently. His doctor congratulated him at every visit. But Robert had quietly withdrawn from his woodworking hobby over the past year, not because he'd lost interest, because he kept making small errors. Measurements were off. His hands felt less precise. He assumed it was just his eyes, maybe early arthritis. When I reviewed his case, his diastolic pressure, the bottom number, was running in the low 60s and sometimes the high 50s. When diastolic pressure drops too low, the coronary arteries that feed the heart muscle itself can't fill properly. And the brain, which depends on consistent pressure to maintain blood flow, begins to show subtle signs of underperfusion. Robert's woodworking errors were not arthritis. They were a circulation issue created by overtreatment. Adjusting his medication brought his diastolic back to the low 70s. Within 2 months, his precision returned. Sign number 3 is that low diastolic number, the bottom number on your blood pressure reading. For seniors, a diastolic reading that consistently runs below 65 or 60 is not a sign that treatment is working well. It is a warning sign that treatment may be too aggressive. The heart needs that pressure to feed itself. The research on this is clear. A phenomenon called the J-curve effect shows that in older adults, pushing diastolic pressure too low actually increases cardiovascular risk, the very risk the medication is supposed to prevent. And this brings us to sign number 4, which is the one most often missed entirely, and in some ways the most important one of all: declining kidney function. The kidneys are extraordinarily sensitive to blood pressure changes. They need adequate pressure to filter waste from the blood. When blood pressure medication drives pressure too low, especially in seniors who may already have some age-related kidney decline, the kidneys don't receive enough blood flow to do their job properly. Creatinine levels rise, electrolytes shift, and over months and years, kidney function declines quietly, often with no symptoms whatsoever, until the damage is already significant. If you are on blood pressure medication and your doctor has not checked your kidney function in the past year, specifically your creatinine, your GFR, and your electrolytes, that is a gap worth closing at your very next appointment. Let me tell you about Frances. Frances was 81 years old. She had been on 3 blood pressure medications for 7 years. Her systolic numbers were controlled. Her doctor was satisfied. But Frances had been having small memory lapses that her family attributed to her age. She was forgetting names she knew well. She occasionally lost the thread of a conversation. At her daughter's insistence, she came to see me. Her kidney function had been declining for 2 years. Her electrolytes were off, specifically her sodium, which had been running low, a condition called hyponatremia that is directly associated with confusion and memory issues in seniors. It was the diuretic component of her blood pressure regimen causing the sodium loss. We adjusted her medications carefully, working closely with her primary care physician. Her sodium normalized over 6 weeks. Her memory lapses decreased significantly. She told me later that she had genuinely believed she was getting dementia. She wasn't. She was over-medicated. Frances's story is a reminder of something I need you to hear clearly. The symptoms of overtreatment, fatigue, dizziness, brain fog, memory lapses, unsteadiness, are almost identical to the symptoms of normal aging. That overlap is dangerous because it means millions of seniors are living below their potential, experiencing avoidable side effects, and accepting a diminished quality of life because no one has ever stepped back and asked whether the treatment itself has become part of the problem. I want to be absolutely clear about something before we go further. I am not telling you that blood pressure medication is bad. Blood pressure medication has saved millions of lives, including people I have cared for personally. Uncontrolled high blood pressure in seniors is genuinely dangerous. It causes strokes, heart failure, and kidney damage. The medication exists for very good reasons. But there is a difference between the right medication at the right dose toward the right target, and a prescription written years ago that has simply never been revisited as your body has changed. You are not asking your doctor to stop treating your blood pressure. You are asking your doctor to treat it appropriately for who you are now at 65 or 70 or 80, not who you were when the prescription was first written. That is not a difficult conversation. That is a reasonable one, and you deserve to have it. So here is what I want you to do before your next appointment. 5 steps. Step 1. Start checking your blood pressure at home, both sitting and standing. Take a reading while seated, then stand up and take another reading after 1 minute on your feet. If the standing number is more than 20 points lower than the seated number, write that down and bring it to your doctor. That is a measurable, documentable sign that your medication dose may need revisiting. Step 2. Keep a log for 2 weeks. Morning readings, evening readings, and how you feel. Note any dizziness, fatigue, brain fog, or unsteadiness. Patterns in a written log are far more powerful in a medical conversation than saying, "I've been feeling a little off." Step 3. Ask your doctor specifically about your diastolic number. If your bottom number is consistently below 65, ask whether that is appropriate for your age and health status. Ask about the J-curve effect. Your doctor will know exactly what you mean and will respect the question. Step 4. Request a kidney function panel if you haven't had one in the past year. Ask for creatinine, GFR, sodium, and potassium. These numbers tell a story about how your blood pressure treatment is affecting your organs, a story that doesn't always show up in how you feel from day to day. Step 5. Do not stop or change any medication on your own. I want to say that one more time plainly. Do not adjust your medication without your doctor's guidance. What I am giving you today is not a reason to stop your treatment. It is the information you need to have a more informed conversation about whether your treatment is still optimized for your health. Blood pressure management after 65 is not a set it and forget it equation. Your body changes. Your medication needs should change with it. And the only way that happens is if you are an active participant in your own care, asking questions, tracking your numbers, and bringing real data to real conversations. Dorothy got her mornings back. Robert got his woodworking back. Frances got her memory back, not because of a new medication or a miracle supplement, but because someone finally looked at the full picture and asked the right questions. You can do the same thing. Now I want to hear from you. Drop your answer in the comments below. Have you ever experienced dizziness, unusual fatigue, or brain fog while on blood pressure medication, and just assumed it was part of getting older? Tell me what you noticed. Your experience might be exactly what someone else needs to hear to take this seriously. And if you have a spouse, a sibling, a friend over 65 who is on blood pressure medication, please share this video with them. Not as a scare tactic, as an act of care. The conversation I've described today could genuinely change their quality of life. In the next video, I'm going to show you the specific blood pressure targets that leading geriatric cardiologists now recommend for adults over 70, and why they are meaningfully different from what most seniors are still being treated toward. That information is worth knowing. Make sure you don't miss it.